7th at 10 p.m. Tonight I'll talk about the anterior human rights when it comes to anti-vaxxers. Thank you for joining me this evening. Well, good evening, ladies and gentlemen. Thank you for joining me this another odd night out here. I generally don't come out throughout the week. Depending on my work schedule, I had a pretty late day today, and I had time to peruse some news articles out there and bring and talk about one in particular tonight. This is a very important one, I think, and I think that you'll find it as important as I do. So I hope everybody had a good weekend. Here we are going into Tuesday. Tomorrow will be the 28th. In just a couple more days, we're going to be heading right into October. And we have some really nice weather coming here for Southern Ontario as well, heading into October as well. So while I was out working and had time to look over some articles, I came across this one article in the Ontario Human Rights Commission when it comes to the anti-vaxxers. Now, the Ontario Human Rights Watchdog says anti-vaxxers don't deserve special treatment. And why should they? All I've seen from these anti-vaxxers in their protesting around hospitals, harassing patients, doctors, nurses. Their first protests around hospitals, they're blocking emergency exits and entrances, shouting racial remarks, hateful remarks, as though it's the doctors and nurses' fault that we had these lockdowns, stay-at-home orders. And when it comes to the vaccines, I don't even know what the hell they're marching about. Nobody's twisting your arm to get the vaccine. Nobody says it's allowed to get the vaccine. But I've been waiting for something from the Ontario Human Rights Commission to come out about this. And they have. Now, if you don't believe in getting the COVID-19 vaccine, the Ontario Human Rights Law says you don't have the right to special accommodations. A statement put out last week by the Ontario Human Rights Commission explains that anyone who chooses not to be vaccinated based on personal preferences, you understand this? Personal preferences, does not have the right to accommodations under the code. Now, personal preferences in singular beliefs not protected. Singular beliefs. Anybody understand singular? The anti-vaxxers need to understand personal preferences in singular under the code. The Ontario Human Rights Commission and relevant human rights laws recognize the importance of balancing people's right to non-discrimination in civil liberties with public health and safety. And I hence the public health and safety, including the need to address evidence-based risks associated with COVID-19. And receiving a vaccine is voluntary. Nobody's making you do anything. So what, I don't know, and again, what the hell are you protesting about? It's voluntary. And at the same time, the Ontario Human Rights Commission position is that a person who chooses not to be vaccinated based on personal preferences does not have the right to accommodations under the code. The Ontario Human Rights Commission is not aware of any tribunal or court decision that found a singular belief against vaccinations or masks amounted to a creed within the meaning of the code. Now, out in British Columbia a while back, the British Columbia Human Rights Commission put the anti-maskers on notice. Now, while the code prohibits discrimination based on creed, personal preferences and singular beliefs do not amount to a creed for the purpose of the code. Even if a person could show they were denied a service or employment because of a creed-based belief against vaccinations, the duty to accommodate does not necessarily require they be exempt from the vaccine mandates, certification, or COVID-19 testing requirements. The duty to accommodate can be limited if you significantly compromise health and safety amounting to undue hardship, such as during a pandemic. And let me make this very clear to you anti-vaxxers out there. This is my human right. I have the right not to get COVID from you. That's my right. So your claims out there of being against your human rights, of these mandates put out by the government, and with these vaccine certificates, that you do not have to be accommodated. You can be and will be refused entry if you cannot provide a vaccine certificate that you are fully vaccinated to go to the gym, to go to the movies, to go to sporting events, concerts, indoor dining in restaurants. This isn't against your human rights and your human liberties. Because if you haven't gotten the memo, you're getting the memo now. Now, last Wednesday, the Ontario government implemented the vaccine requirements for high-risk indoor settings. And people must show proof that they're double vaccinated in order to get inside restaurants, nightclubs, concert venues, gyms, sporting events. Thank you for joining me this evening. So, as you can see, this is a rare night for me to come out here. I'm generally really busy throughout the work week with working and personal life. But while I was on my downtime today, it gives me a chance to look over some articles, see if it piques my interest, see how important it is to me, and I feel how it is important to you. Now, I came across this article, and I've actually been waiting to see, what the Ontario Human Rights um, has to say about the anti-vaxxers. Now, I'm talking about the anti-vaxxers who, on personal preferences, singular. Little recap for you, and thank you for joining me. In a statement put out last week by the Ontario Human Rights Commission, explains that anyone who chooses not to be vaccinated based on personal preferences does not have the right to accommodation under the code. So I say again to these anti-vaxxers, what the hell are you protesting about? You go out there, you cause a scene, and you cause trouble. Your protests around the hospitals are ridiculous. They're meaningless around hospitals. Not only they were doing this around hospitals, they were harassing staff and patients going into the hospitals. They were blocking the emergency entrances and exits. What the hell does the doctors and nurses have to do with the mandate settled by the government? The very people who's been on this front line from the beginning trying to save lives, these anti-vaxxers go out to harass them. Just the other day in downtown Toronto, they're clashing with police, trying to get into the Eaton Centre to protest. Now, as it is here in Canada and across all provinces and territories, it's not illegal to protest, but there is a right way of doing it. You protest your government. Out in British Columbia, they went into an elementary school to protest. That's crossing the line. And you're not even vaccinated. In the province, Human Rights Code prohibits discrimination based on creed, such as religious beliefs or practices. However, singular beliefs do not amount to creed, as stated in the code. And even if a person could show they were denied a service or employment because of creed-based belief against vaccinations, the duty to accommodate does not necessarily require they be exempt from vaccine mandates, certification, or COVID testing requirements. I don't know how the anti-vaxxers miss these memos. I can tell you this, they don't bother to look at the Canadian Constitution. They don't bother to go on the site of the Ontario Human Rights Commission. I'm reading this from the Ontario Human Rights Commission. You see, ladies and gentlemen, governments, when they're sworn into office, they're also swearing to protect their citizens. When it comes to things like war, natural disasters, viruses, your government has a sworn duty to protect you. So when they come out with these mandates of stay-at-home orders, shutting down non-essential services, closing businesses and schools, the government can do just that because they have to do that. Now, just imagine for a moment that they did absolutely nothing. Well, we've seen what happened in the United States on the onset of this pandemic when diaper Donald Trump was president of the United States. Oh, this is nothing but the flu. It'll be gone when the warm weather comes. Well, the warm weather has come and gone 18 months. And throughout the United States, and I was watching the news this evening, you're looking at about what they said it was somewhere around 2,000 people are dying every day from COVID-19. You can believe me, you don't have to believe me. That's one about every 90 seconds dying from COVID-19 in the United States. You're probably pushing about 700,000 deaths by now. Here in Canada, throughout the pandemic, probably about 25,000 people have died due to COVID-19. Out in the western provinces, Alberta especially, has hit a crisis. See, over the summertime, effective July 1st, out in Alberta, the government lifted all mandates, lifted all restrictions. We are going to have a COVID-free summer, he said. The premier. And now you're in a crisis. And now you're reaching out to other provinces across this country, and you're reaching out to the federal government for help from the military. Now, back in the early spring, here in Ontario, the largest province of this country, of Canada, over 16 million people, we've had our ups and downs throughout this pandemic of openings and closings. And when we opened up, we tried different things. We went regionally. Well, this region has more cases, so you can't open yet. This region has less cases, you can open. That didn't work. So then we had to go back to the entire region, that everybody in Ontario have to follow the same mandates. We made errors along the way. I'm not saying we're perfect here in Canada. I'm not saying we're perfect here in Ontario. But we didn't lift all the restrictions like they have done out west in Alberta. It is so bad in Alberta right now that they're going to have to decide who lives and who doesn't. They've canceled heart surgeries, open heart surgery. They've canceled all these surgeries because their ICUs are filled up with COVID-19 patients. And guess what? They're unvaccinated. Here across the province of Ontario, yeah, we're still having some problems with it. School is back in. We're seeing cases in the schools, but nothing compared to Alberta, where they are seeing well over 4,000 cases a day right now, because they lifted all restrictions back in July. Geez, that must have made the anti-vaxxers really happy about that. But when the Ontario Human Rights Commission comes out with this statement that based on singular person reasons why you're not getting vaccinated, the Human Rights Code doesn't apply to you. Now, with these implemented vaccine requirements for the high-risk indoor settings, that you'd be fully vaccinated to go to a gym, a movie theater, dine in a restaurant, sporting events. You have to have a vaccine certificate, whether it's in a PDF form or from the government website with your information on it, to prove that you're fully vaccinated with both shots. Then you can go to the gym, you can go to the movie theaters, you can dine inside a restaurant, you can go to the sporting events. Now, just over this past weekend here in Ontario, the top doctor of Ontario and the government is increasing capacities, not by much, for indoor venues. If, for instance, if your establishment, like the Budweiser Gardens downtown here in the city of London, holds 9,000 people, the capacity can be 4,500. Being that where the Toronto Blue Jays play in downtown Toronto, being that it's an open dome and they can open the dome, they can have something like 20,000 people at a baseball game. Fully vaccinated people. Now, at first, our premier, Doug Ford, here in Ontario, he didn't really like the idea of the vaccine certificates. He said he didn't want to have a split society. Here in Ontario, 70% of the population here in Ontario is fully vaccinated, or more, actually. And more people are getting vaccinated, and yes, you may call in, and more people are getting vaccinated.
Hi, Trucker. How you doing?
Hey, good. How are you doing today?
I'm doing good.
Whereabouts are you calling from?
New Jersey.
You're calling from New Jersey. Well, thank you
Yeah.
for calling me from New Jersey.
I heard what you're saying, and people, about the vaccine, people are getting frustrated. Even at my program, people are getting frustrated because we supposed to go in the community on these field trips, and we can't because some of the people is not vaccinated.
No, yeah, I understand that, and we're here, here in Canada, in Ontario, where I reside, people, there's people who are still not vaccinated, but I mean, for different reasons, like because maybe they have medical conditions of why they
Mm.
can't get vaccinated. I talked about people who have a phobia of needles,
Yeah.
and then there's people who are still, you know, have questions about the vaccines, but why they're still dragging their feet, for those people. I mean, you can get the answers by talking to a healthcare professional.
Well, I wanted to go on this. It's a day trip. I wanted to go on this trip to ABC Studio, and first I call ABC up. You know the network WABC?
Yes.
Well, I call him up and I said to one of the news people, I said to him, can I come and visit David Muir from World News Tonight? That took over from Peter Jennings, and she said to me, "Not right now, because the ABC studio, we have a strict require people coming in. We don't want people coming in like a tour like that yet. Like, I know you're gonna be wearing the mask, but we still don't want people there. When the COVID is not here no more, you can definitely come to ABC studio, but that's not yet because we're being cautious."
No, that's right, and that's understandable,
Yeah,
right? Because they want to, because they don't know who's vaccinated, who's
yeah.
not vaccinated, stuff like that. So what I was talking about tonight, here in Ontario, Canada, is that the Ontario Human Rights Commissions explains that anyone who chooses not to be vaccinated based on personal preferences does not have the right to accommodations under the code.
Yeah.
Right. So here, we've had, the anti-vaxxers out there protesting,
Hmm.
and they have protested in front of hospitals,
Wow.
and not just protesting in front of hospital, but harassing the doctors and nurses going into work, harassing patients going in for their treatments. Um, they're not, they're clashing with the police. And even though it's legal to protest, there's proper ways of protesting.
Yeah.
And the hospital isn't one of them, because the are not the ones who mandated the rules. The
Yep.
government has mandated the rules.
That's right.
So
And I was working. Sorry to interrupt you, Chuck.
it's okay.
I was looking on YouTube, and I was reading the comments on YouTube and other channels, and people are saying I am done with 2021, and I wish it. People are saying they wish it was still the 90s and 80s decade.
Yeah, well, I mean, yeah, because we miss,
Yeah.
just doing what you want, and not to worry about anything. There wasn't any viruses, except the flu virus that goes around every single year, but nothing really serious thing to worry about, right?
Right. Well, I know why
Be it
they're
go back
saying
to
that.
normal.
I know why they're saying they wanted to be the 80s, 70s, and 90s, because that was good television, and they can flip the channel to see what was on. And I know why they're saying it, because it was good television, don't you think?
I'm sorry I didn't catch that last part.
Don't you think it was good television at the time? Like, you got Three's Company on ABC, and then you got Golden Girls at the time that was running at the time, and that was very good quality television.
Oh yeah, I mean, I remember, I remember
Yeah.
those shows as well, and that. So, yeah, I mean, because just be able to go out in large crowds, go to
Yeah.
concerts, go to sporting events, you know, going to the gym and movie theaters, you didn't worry that you weren't going to catch a virus.
Mm-hmm.
Nothing like this, anyways. You know what I mean? I mean, this COVID-19 and this Delta variant. is pretty serious.
Yeah,
And
when
I
when
just
when I was in the bear cave, we didn't have like no max and stuff like this. This is before COVID, and we have more freedom. I don't think we have freedom at Friendship House no more.
mhm, yeah, but yeah. Oh, I mean, I understand what you're saying,
Yeah.
you know, but with I mean, we're having problems here, across Canada. I just recently talked about one province out west, Alberta. They're in a crisis right now with this. They're seeing well over 4,000 cases a day. They're a smaller province than Ontario is. And the reason why they're in this predicament is because back in July, their government lifted all mandate rules,
Wow.
right?
Right.
And, figured that it's going to be okay. And here they are in a crisis that the ICUs are full. They're canceling all kinds of surgeries. People who need heart surgeries are not going
That's
to get their heart
terrible.
surgery. It is terrible, and the government out there, in that province, the premier of that province, lifted all these mandates, and now he turns around and he said, "Oh, we're not going to go back to lockdown." It wouldn't be, he says, people are not going to follow the rules anyways. And that's just like saying, you know, we're going to put in a speed limit. We're not going to put in a speed limit because no one's going to follow the speed limit.
Yeah.
You know what I mean?
Yeah.
So now, Canada, I mean, us Canadians, we're going to pull together and we're going to help them out. We're going to send our military in there as well, and we're going to send doctors and nurses in there, to help them out, and that, because we don't want to see anybody in that predicament. But all I can say is about the premier is that you messed up. You need to fix this,
Hmm.
or resign. I mean, our premier here in Ontario, I mean, nobody's perfect. We all try to do the best that we can. And when we think things are getting safer, we lift restrictions here, we lift restrictions there.
Yeah.
And then you realize that it's too early to do it. And then you have to go back and say, you know what, we're really sorry, but, we got to go back to shutting down non-essential businesses, stay at home orders,
Well,
close the schools.
there is a lot that my Friendship House um the program that doesn't do today. Like I can name you a couple of things. Like Mara the teacher there, they won't let us go to Dunkin' Donuts or Six Flags because it's too far, or to a library because you have to call the library for an appointment, and we can't go to Dunkin' because it's not healthy.
Mm-hmm.
Because of the parents. The parents have to say yes, and these parents are so unprotective with these kids. And I have nothing like this when in 2000 when I was still at the bear cave, and they don't come the same way. And um, I think they so protected of the child, and there's no need for that. And to not go Dunkin' Donuts, me and Sarah were saying like, why we're not going to Dunkin' Donuts no more? We used to.
Well, I really don't know. I don't really know how to answer that or what to
Yeah,
say to that. Um, you know, um, I guess for healthy choices, I
yeah,
guess, you know. Um, but yeah, I mean, your Dunkin' Donuts is open, is it not?
yeah. It's open, but I think what she was saying is Dunkin' is not like that healthy choice compared to fast food restaurants and stuff.
Yeah, fast food restaurants is not really a healthy choice. But fast
Yeah,
food restaurants like McDonald's, Burger King, Wendy's. They have the veggie burgers.
Yeah.
Like the non-meat burgers, I guess, for
Mm-hmm.
healthy choice and stuff like that. So for vegans, people who don't eat meat and that. So I mean, they're trying to make changes that way for healthy eating and stuff like that. But when we come to the mandates that we have, here in the province of Ontario, and every province is different depending on their circumstances. Right now, anybody who wants to dine in a restaurant or go to a movie theater or a gym or a sporting event, you have to show your vaccine certificate that you're fully vaccinated.
Yeah. Well, I got something to add to that. I remember my grandma that passed away, and my grandma didn't even follow the COVID restriction.
She didn't follow what?
She didn't follow the COVID restriction. I said to her on the phone one time, "Why are you going to your sister's house?" On TV they are saying to say stay home because we're in lockdown at the time, and she said like I can go to my sister, and she didn't follow the COVID restriction, and I bet she didn't wear a mask. She didn't wear a mask at the time, and I was telling her you need to follow the COVID rules, and she did not follow the COVID rules. She just went there with no mask, especially when you have a lot of people around you. You need to have a mask on.
Hmm. Yeah, we have that rule here. We still have that rule, right? And that rule still applies for indoor public buildings,
Yeah.
that you have to wear a mask, and that. But these mandates for fully vaccinated individuals, like what I said, for to dine in a restaurant or go to the gym and movie theaters and sporting events, you have to show that you're fully vaccinated.
Yeah.
But for grocery stores and drug stores and things like that, it's not mandated for that, right? Because I mean, food is a necessity, so anybody can go into a grocery store. But still in the grocery stores, we still have that 6 feet social distancing and everything else throughout the checkouts and stuff like that.
Mhm.
So people are staying away from one another. Now, of course, still, with the anti-vaxxers out there and in some businesses, some restaurants, saying that they're not going to follow the mandatory vaccine passport program, which at the end of the day, they're subject to hefty fines, and so are the people that go into these establishments not providing proof of vaccine. They're also subject to heavy fines as well. So this one particular restaurant, and I'm not afraid to say who this restaurant is. I'm going to call them out, because it's just absolutely um, ridiculous. And it is called Zucchini's Cucina, and it's located in Oakville, Ontario, on 438 Kerr Street. And they're
Wow.
saying that all people are welcome, and we do not discriminate against any customer regardless of sex, age, religion, creed, or vaccination status. Now, sex, age, religion, and creed has nothing to do with the mandated rules,
Mm-hmm.
right? The mandated rules specifically state that you have to show proof of vaccination, right?
Right.
So this restaurant could face up to anywhere from 5,000 to 10,000 every single day for every infraction, right? A
Right.
person, an individual who is in the restaurant and has not provided any vaccine information can be fined $780,
Wow.
right?
Mm-hmm.
Now, there was this. one particular, this, kind of really irked me. And I wanted to find it here because what was said was he was referring, if I can find it here, because it was, I just found his statement had no bearing on anything. And I think I'm coming down to it now, what he said here. Um, he kind of refers, um, these rules and regulations imposed on us, to the, um, I guess, the the black movement in the United States, right? Black Lives Matter,
Right.
or even just their civil liberties throughout the United States. With the civil marches,
Mm-hmm.
that went on through the United States. When you look back in the 50s and 60s and things like that, Martin Luther King and people like that, marching, marching for their civil liberties. And he's kind of comparing this to that, and I'm thinking that has no bearing. That's entirely something different. It's Black African Americans want their civil rights and liberties, right? This has nothing to do, they're anti-vaxxers and with their protests. There's no comparison to the civil movement in the United States or anywhere or anywhere else in the world. And I thought this guy has been, he has been fined several times for breaking the rules. And he goes on Facebook, he goes on YouTube and stuff like that. He just thinks this is a big joke. And this restaurant here saying that they're not going to follow the rules. Well, I got news for them, that they either follow the rules or be fined or be shut down. And, in that order. So, other restaurants, I mean, at first we were talking about, what is going to be the vaccine certificate and how is it going to work and stuff like that, because the province of Quebec was the first province to bring out this vaccine certificate. And then British Columbia came out with it. And then I think it was Saskatchewan, then Manitoba, and now Ontario. And this just started last week. But, when I'm thinking to myself, where do these people think that these mandated rules become against their human rights? I mean, they don't take the time to read the Constitution.
Mm-hmm.
They don't take the time to read the Ontario human rights rules, what they are, right? They just assume,
Mm-hmm.
right? Something they don't like, they just assume it's against their human rights,
Yeah.
right? It's just like when the government invokes emergency orders because of a virus,
Mm-hmm.
right? The government, under law, has to protect their citizens.
That's right.
They're sworn in office to do just that. If in event of a war, natural disaster, and viruses, they, under law, have to protect their citizens. And the mandates that they put forth are legal. And some people out there just don't seem to understand that,
Well,
and their fighting cause is just going unanswered, and it will continue to go unanswered.
Well, people on my YouTube channel, when I used to do that, run my channel, they used to say when I put all TV shows, I missed the 90s, 70s, and 80s. And I said, well, we're in 2021 now because of COVID. But if you still want to see the 90s and 80s, go on eBay and buy the cassette tapes of it because there's some tapes of people recorded shows from a long time ago and just get the whole thing, the box set.
I don't understand why they're even worried about the 70s, 80s, and 90s. I mean, you know what I mean? I mean, this is, we're in the 21st century here. We're in year 2021.
Well,
So none of that.
I still watch the 70s and 90s because it wasn't COVID then, and I know it's COVID now. But everybody think it's great television. And I said, yeah, it is. But why are you still in that generation? And because they say to me on the comments because all the shows was on Mass, and I said, oh, that's why you like to watch the 70s and the
Yeah.
80s.
Yeah, I guess it just gives them that sense of
Yeah.
that sense of freedom and stuff like that, and what it's like just to have all that freedom and everything else like that. But I mean, we still have. I mean, we have our freedom. Restrictions is entirely different to what your freedoms are. They're
Yeah.
restrictions to protect you, right? They're not restrictions for punishment. We did nothing wrong. You know, the world ended up with this virus,
Mm-hmm.
and now we have to deal with it, and the governments have to deal with it, and they have to deal with it because under law, like I said, they have to protect citizens of
Mm-hmm.
their country, their state, their province. It doesn't matter. In a democracy, they have to protect us, whether we like it or not. And the people out there, it just thinks everything that the government does is against their human rights, which is just absolutely ridiculous. And I just sometimes I just get so tired of the BS. From anti-vaxxers, people are so stubborn and selfish that they're not going to get vaccinated, right? But I have rights too, and you have rights too. You have the right not to get COVID from anti-vaxxers.
Well, I think it's just annoying to me that one of the teachers from the front step house, she want me to put my mask on. I keep saying to her, I'm vaccinated. And she said, I know, but other people in the program are not. And, and there's no reason for me to have a mask on when you're, fully vaccinated, right?
Well, let me explain something to you. All right, the vaccine is not a cure, just like the flu shot is not a cure.
Yeah.
What the vaccine is going to do is going to, so you'll have, you won't have, hopefully you won't have the full-blown COVID. It'll lessen the symptoms. So it is still necessary for you to wear a mask. I'm fully vaccinated, and I wear a mask when I go grocery shopping. I go to the drugstore. I wear my mask when I meet customers. Right? I wear my mask when I feel that social distancing isn't happening.
Mm-hmm.
Right? And I'm fully vaccinated. What you need to understand is that you still can get COVID.
Yeah.
You can still get the flu with the flu shot, right? But it's a protection of that you won't get the severe symptoms. You have to that's what you have to understand. So when they say you have to wear your mask, not just because other people aren't vaccinated, is that it's still protecting you. It's just another thing that we need to do right now, whether you're vaccinated or not, is to wear your mask when you are in a group of people.
Well, I have a mask at home. I have a mask that I wear to friendship house. The paper mask I do not like, so I came up with another mask. I have the ABC Perfect Strangers mask and the bear cave mask. The bears represents my old school, the bear cave. So I put both of them on, and it's better for me than the paper mask.
Sure, whatever works best for you,
Yeah.
right? I wear a cloth mask. I don't like the blue hospital masks. I mean, I have a bunch of them too, but I have a cloth mask. I have several cloth masks and stuff like that, and I wear my mask, all the time when it's needed to be worn, and
Mhm.
I'm fully vaccinated. So it's still important, to protect yourself, and stuff like that. And here we are coming into October. In about mid-October, the flu season starts.
Yeah.
And then people, who get vaccinated will get vaccinated. I get vaccinated for the flu. I'm in my late 50s.
Wow.
So I get vaccinated for the flu. I have elderly parents. They get
Well,
vaccinated for the flu. They've been vaccinated for COVID.
Well, my mom has a rule. Is my mom was saying if you want your Bear Cave friends to come to the house, you have to ask them are they vaccinated, because I have to ask if Darius or Gregory are they vaccinated before they come to the house.
Hmm.
And I did ask them, and Gregory is vaccinated. Darius is vaccinated. So they will both. They said I will. We both will come to the house because we're vaccinated. And I let my mom know. My mom said that's okay with me if they come. I just want to make sure they're vaccinated so we won't get anything.
That's right. That's a good idea. That's a really good idea. You know, so and as more and more people get vaccinated, and I say this on my show too. Um, do the right thing, right? Protect yourself, protect your loved ones, protect your coworkers, and society in general. If we all get in line and do the right thing, we can get out of this.
Hmm.
But it's going to take all of us to do this. And the anti-vaxxers, people who just think that none of these rules apply to them, right? It's not a law that you have to get vaccinated, right? It's a choice, right? You make the choice not to get vaccinated. You are putting not only yourself at risk, but others in your family and loved ones at risk of getting COVID-19 and this Delta variant, which is far more deadlier than all the other variants, and they're just rebellion, against these mandates that the government has put forth. They're part of the problem, not part of the solution. And I just get so fed up with it, when I see their demonstrations, and their demonstrations are basically meaningless. It's not a demonstration, for progress. It's just an anti demonstration because they're just so selfish and so stubborn not to get vaccinated that they're the ones who are filling up our hospitals. They're the ones who are filling up our ICUs.
Hmm.
That's the intensive care units. They are the ones who are becoming the problem.
Well, me and my friend Sarah Como. So me and my friend have a talk today on FaceTime, and Sarah was explaining to me, like, we can't go on trips no more. We can't even. We're so claustrophobic in the building. We can't do anything. I said, well, talk to Elena. I tried to talk to Elena, and I make no headway with her. So you talk to her. And Sarah said no because she Rowena doesn't listen to us. And I just think if she listened and like this is what program is, go out in the community, we can't even do that because she got us so claustrophobia in this one building, and that's terrible.
Yeah. So what is um, the I
Friendship
guess
house.
yeah. So what is the COVID-19 situation in New Jersey right now?
Well, in New Jersey, um, um, well, everybody is still wearing a mask,
Hmm.
and I think some of the rules we have at the day program Friendship House is like Lorena have these rules and we can't go on field trips yet. And if we want to bring something to the table, Lorena won't even listen to the fact like we want to go for a walk or go to Dunkin' and she doesn't meet us halfway. And um, and she doesn't even listen to the part we're trying to say. So Mara is more outgoing than Rowena because me and Rowena don't see eye to eye, and she just said, "Oh, the hell with it, this and that," and that's all I get out of her.
Yeah. I don't know. I mean, I guess they're just looking out for your well-being.
Yeah.
Is what I can make out of it. They want to just keep you safe and
Mm.
keep you protected and things like that. I know it's frustrating, and the whole world, everybody's going through this mental health, financially. It's been a real struggle for a lot of people, and my empathy goes out to everyone, who is struggling, um, with this pandemic. I have a lot of empathy for these people, and we all have COVID fatigue.
Mhm.
We're also very tired. We just want this to be over. We want this to be over as though it never happened. you know so I mean, my heart goes out to people who are suffering mentally and financially, and people who have families who have lost loved ones due to COVID. It's tragic. It is really tragic. But like I say, when it comes to these protests, and the protests get out of hand, and that to me, that's not a protest. You know what I mean? And
Mhm.
for these individuals, who just keep going out there and protesting, these rules and mandates settled by the governments and healthcare professionals, is against their civil liberties, it's against their human rights. When I'm talking about the Ontario Human Rights Commission, putting out this statement that it's not, these mandates are not against your human rights.
Oh, Truck,
And
if you're
some people don't seem to get that.
if you're on tomorrow doing the podcast, Truck, I will be on tomorrow, and one of my friends, Sarah, will be on the call tomorrow too with me.
Yeah, what usually takes place with my podcast is that, generally I do it on weekends.
Oh,
The
okay.
odd weekend, the odd weeknight, like tonight, because I was done work early, and I wasn't too tired, because I don't like doing a podcast tired, because then I lose my concentration, and the mind gets all fogged up because your brain is saying, no, it's time to go to bed, you got to go to
Yeah.
sleep, and you don't concentrate that well. But I didn't have a long day, so and I felt that tonight would be a good night to do a show. But generally, I do my shows Saturday mornings at 9 a.m. Um, Saturday evenings at 9 p.m. and Sunday mornings at 9 a.m. And we're on the same time zone, you and I,
Mm-hmm.
because it is 11 p.m. right now, and it's 11 p.m. in New Jersey.
Well, you can join my podcast if you want.
What's that?
You can join my podcast if you want.
Okay. So you do like you do have your own like YouTube channel?
Yeah, I do. I used to do on there. I used to do ABC promos and
Okay.
singing. Um, I tried to sing on there.
Oh,
Um, there's a couple of different things. I used to do ABC promos, like when I say Tuesday night, who's the boss? The old ones.
okay. I see. Yeah, I see. That's cool. That's really good that you do that. That's really cool.
But on my channel, I mean podcast. On my podcast, I talk about the Bear Cave old TV shows, and I talk about the COVID. Um, I talk about a lot of things on my podcast, but basically, I talk about how hard it was to leave the first program that I really love to go to.
So your podcast is called ABC Seven Show,
Yes.
and are you on Podbean?
No, what's that?
Well, Podbean is what you're on. Well, so like my provider for my show is Podbean, right? So how did you find my show?
Well, I said I think by popping.
Yeah, Podbean. Yes,
Yeah,
yes. So that's like you can find my podcast um, anywhere on the internet, right? So
right.
you can find me on Spotify. You can find me on iHeartRadio. You can find me on Podcast Addict. You can find me on the Truckers Podcast on demand. I'm on this. You just Google the Truckers Podcast, and you can see my logo, the blue truck and right my in the white trailer. So you'll find me on probably 13, 14 different medias.
Wow.
After this show is live, and then after I publish this show, it'll go out to other 14, probably about 14 different medias. So, but yeah, so and so your ABC 7 show, you're on Podbean?
I think I am. I don't know if I did it right because this is my first time doing a podcast, and I don't know if I exactly did it right.
Okay, well, yeah, when I started out, almost 2 years ago, I really wasn't sure about how it all works and everything else like that. So being not tech savvy, I had to figure out a lot of things, to do a live show and what I needed to do and was I doing it right and stuff like that. But 288 shows, that I have put out, you know, um, this coming January will be 2 years,
Wow.
and it's something that I like doing. I'm going to continue to do it, and I think it's a lot of fun and it's interesting. I mean, when you ever get to talk to somebody that you will probably never meet, and somebody like yourself from New Jersey,
Yeah.
right? And talk to you live, and have listeners on the show, listening from around the world. while I'm doing this show live. I mean, where else can you do that?
How do you get people, like, say if I want people to go on my podcast, how do you do that?
Well, what I did is that my first couple shows, I probably had maybe 2-3 people a show.
Wow.
People, they'll just keep scanning for that. But when you do your show, at the end of your show, you tell them, the next time when you do a show, when you're going to be on, and what is it going to be about, and stuff like that. It takes time. You know, you don't don't rush things. Don't get disappointed. It'll all come together for you. So right now I have over 2,000 plus listeners from around the world. I'm a small podcaster. I mean, there's podcasters out there who get 10,000 downloads a day.
Wow.
I might get 60, I might get 40, I might get 20. And I've been doing this for almost 2 years, and I'm okay with that. I don't let the numbers bother me, because I'm doing my own thing. I'm not worrying about what other podcasters are doing out there. I'm not worrying about other podcasters of, hey, why are they getting 10,000 downloads in one day? Why this, why that? That's their show,
Mm-hmm.
right? And they're getting that, because they've probably, been in radio before. They've had some experience with broadcasting or whatever, and they have connections, and they get these important people on their shows to talk on their show, and stuff like that. And my show is to talk to you, share things with you with current events, local world news, and what's trending. People come on and listen. People like yourself call in, and that's the way it is. But don't be discouraged. It'll just come along, and you just do your own thing, and you will get followers. Does that help you out a little bit?
It helped me out a little bit. I just don't know what I'm doing far as that, because this is not like me doing Instagram Live or YouTube channel. This is something totally new.
Mm-hmm. Mm-hmm. Yeah. See, for me to have a YouTube channel, and I was actually I was looking into it one day and thinking, how do you get a YouTube channel? Because when it comes to like I say, computers and stuff like that, and I'm 58 years old.
Wow.
So I was when I was a kid, none of this stuff existed. There was no such thing as a smartphone. There was no such thing as computers. None of that stuff, right? But then I was looking into it, and I'm thinking, man, that's just a lot of work to set up a YouTube channel,
Mm-hmm.
and the podcast was so much easier to do.
Well, I set my YouTube channel up from Google, because I set everything up from Google.
Okay. Yeah. See, I was going on, like, I searched on YouTube, and of course I searched Google too on how to set up a YouTube channel and stuff like that. And depending on what you want to do, and what you want to create, and your logo, your intro music, and your topics, and if I were to do a YouTube channel, I would like to do it with a couple of people.
I know.
Whereas in my podcast, yeah, I could have 5-6 people, in my home, with microphones and headphones,
Yeah.
doing this podcast, but I'm doing this solo, because, I talk a lot, and I like to talk. And I figured, what is the best way, of getting, my thoughts out there, my opinions out there, instead of talking to myself, you know, and share my thoughts and opinions with the world. And there's no better way of doing it than a podcast,
Mm-hmm.
right?
Right.
And it goes all over the world. Right now I'm in like 15 or 16 different countries
Wow.
around the world listen to my podcast.
Oh, Tucker,
Yeah.
I want to tell you this. I have a fairly old thing downstairs. I have a standard case Lionel Twain.
And what is that?
It's something that my grandpa gave me. It's a fairly old standard gauge Lionel Twain. It's on C scale track, and it it did whistle one point, and the gears start to move, but the gears are shot, and the whistle is busted. So that means it doesn't run no more.
No, that's right. Yeah.
Yeah.
Yeah. That's cool. So I hope, just, don't, like I said, don't get discouraged, with your podcast. Just go out there and talk about whatever you want to talk about,
All right.
right? That's what you do. And it'll all come together for you. So I'm still a newbie. I'm still new to this.
Okay.
I haven't hit the novice. I think I have something like 23 hours more to go before I hit novice. So it's still a ways off, 24 hours. I mean, I try to do an hour show. Sometimes my shows are 45 minutes, 50 minutes. Today's like an hour, almost an hour and 15 minutes. But like I say, I'm not worrying about the numbers. I just come out here and talk to you and share my opinions about what's going on in the world. That's what I do. So hopefully, that give you, just don't be discouraged. Just go out there and just talk about whatever you want to talk about.
Okay.
If doing talking about the 70 shows and 80 shows and 90 shows, that's a great topic. That's a fantastic topic. People are interested in that. People reminisce about those shows. I reminisce about those shows growing up. Watching Happy Days in the 70s, watching MASH. Watching all those different shows. I grew up watching those shows.
I have 140 VHS tapes of all of them on tape.
Wow.
Recorded from people on eBay. Recorded. I feed these stuff and like, oh my God. I wasn't here to see all of them because I was born in 1997.
Okay. Well, there you go. You see, I mean, I don't have any of those, so you certainly have way more of what I've got when it comes to that stuff. So, you got you got your foot set. You've got the information, right? And you can go and you can talk about these shows because now you get to experience them, and you can go out and share your experience.
Well, one of my friends, Son Gluer, was saying to me on the phone when we talk, he was saying to me, is Mass and Full House coming back to CBS or ABC? And I said, no, it's not even, they're not coming back to those network platforms. That was years ago. You know how many years ago was that? That they were on it. He wanted them to come back to the TV, like ABC or CBS.
Yeah. Yeah. Well, maybe just the reruns.
Yeah.
But that's about it. But those, I mean, if that is something that intrigues you, that's something that you're excited about to talk about, by all means, a podcast could just be about anything, and people just like they just use their imaginations. They just, I've listened to podcasts where the show is like Seinfeld. It's a show about nothing, and it's a great podcast,
Mm-hmm.
right? So if something that like with you, with the 70s, 80s, and 90s, and you're going back to watching these, and you're really interested in them, and you want to share that, people will listen. They will. People will listen because people like myself, we grew up watching those shows.
Do you ever watch a show called with Source Calling at Science Time Station?
Oh God, that was probably like, oh my God, that was like many, many years ago for me.
Because Source Calling play a small miniature Mr. Conductor, and
Yes,
there was bits and pieces like breaks of it when he blows the whistle and Thomas will come to life.
that's right. Yeah, yeah, that's right. See, stuff like that. People will listen.
I remember watching that show, and I think I was 12 in 1997 when I watched it.
Yeah, yeah. Well, there you go. you know. So, and George Carlin, he was great doing kids shows and stuff like that. But he was also a really funny man. He was a great comedian.
He was
And,
on Fox on the Source Calling show, and David Mitton directed the Thomas stories.
okay, yeah, 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 yeah.
And
So,
Britt, if you don't know her, Britt Arcock, that wonderful producer, Britt Arcock came to Source Calling with the project of the Science Time Station, and she promoted the Thomas and Friends.
okay, yeah, yeah, that's really cool.
Yeah.
Yeah, so there'll be, yeah, that just be for you to talk about, like I said, those shows and stuff like that on a podcast. Yeah, go out there and give it a shot. And have fun with it.
Mm-hmm.
But for now, I gotta let you go.
Okay.
Because I have to get up early in the morning to head out to work. Like I say, this is just an odd night out for me. And when I look at news articles and stuff like that, and this one particular one with the Human Rights Commission on anti-vaxxers, it was an important topic to get out there. So thank you for joining me. It was
You're welcome.
an honor to talk to you. You're a bright young man, and thank you for joining me and all the guests on my show this evening. Thank you for coming out here this evening. And like I say, I'll be back out here Friday night at 9 p.m. If you can join me then,
Okay.
I appreciate it. If you can't, I understand. So again, thank you.
Bye.
This is the Truckers Podcast. I'm your host, Doug from London, Ontario, Canada. Have a good evening, ladies and gentlemen. Have a safe week out there. Take care.